What is your view on holistic health? And obviously, if ideally, if everyone went on a Mediterranean diet and they were able to go to therapy or anything like that, but where is the medication side coming into it? As from your background, what are your views?
Yeah. I mean, I'm not anti-medication at all. Like, prescriptions are absolutely vital for many, many conditions. Um, but we also need to explore kind of what's driving symptoms. I think again in, lots of IBS patients I work with have been through the healthcare system and have just been told to try this other pill, try this other medication, try this other fiber supplement, try this probiotic.
Mhm.
And although they can help to a degree, I always suggest like zooming out and looking at the bigger picture. You can't just take a probiotic in the hope that it will put a band-aid over the problem, especially when it comes to IBS and other functional gut disorders. We need to like really zoom out and look at the bigger picture and see what could be driving symptoms. So I guess like the sweet spot is to really consider using both. So often like medication for short-term management, like for example, I have some patients with like very chronic diarrhea predominant IBS, and like using things like Imodium, that's
Yeah.
absolutely recommended and I would encourage, just so you can kind of manage that short term and have an improved quality of life. But then using holistic tools for long term support and prevention of symptoms or management of symptoms. And like I often collaborate with doctors to ensure that patients are feeling fully supported from both angles. But I also ask, what's the patient aim here? And 9 times out of 10, they say, I don't want to be on long-term medications. And for IBS, there's absolutely no need to have to stay on medications long term. It does depend on the gut disorder that someone's suffering from. Of course, for more complex issues like inflammatory bowel disease, if inflammation is very severe, then medications are
Mhm.
certainly recommended. And although diet plays a big role, it's not going to completely heal the gut. Sometimes we do need medications in the beginning, but then when patients are in remission, then absolutely the aim is to come off those medications and things can be managed from a dietary and lifestyle perspective.
And tapping into that lifestyle side of it as well. You obviously have the movement side, being active. You yourself are a yoga teacher, therefore a big believer in all of this. Can you talk me through the benefits of moving your body, specifically yoga, and how it can actually not only, strengthen, tone, whatever it is that we would look for normally, not normally, but maybe historically we would view exercise as kind of separate to our mental health. And obviously this discussion has been really, really opened up in recent years of the links between that and therefore the gut even more recently of how it can impact. But what's your view on yoga exercise? Where does that come in your professional work?
Yeah, I mean, I, like you said, as a yoga teacher, I love recommending people try yoga.
Mhm.
And for many people, I believe they view yoga as a form of exercise. When we actually look at what the yoga practice is, it's a spiritual practice, which of course involves part of that involves moving your body in a way that improves strength, flexibility, and as a byproduct, tones muscles and makes you feel and look good. But when we break it down in terms of why yoga is so good for our health, well, of course, the physical postures and the movement, known as the asanas, and specifically for gut health, they can like stretch and lengthen our digestive organs. They can give our digestive system a bit of a massage, and again, also gets the body moving. And we know exercise can increase those endorphins, those feel good hormones. That's why after you do exercise, you feel like, oh my god, I feel great, I can conquer the world. So that's kind of one element of the yoga. But then another element of the yoga is also the breathing, the breath work that is involved. So often yoga is synced, you sync your movement with your breath. And the science shows that breath work can activate that parasympathetic rest and digest nervous system. So that's another reason why yoga is particularly beneficial. And then, kind of, the third reason is also then the meditation and mindfulness element that yoga incorporates. So being very present, which can again help to reduce stress and relax the nervous systems. When we look at that on a physiological level, studies that have looked at like meditating monks, for example, they did MRI scans of their brain and it showed that the size of their amygdala is significantly smaller in compared to non-meditators. And the amygdala is like that fear center of the brain. And a smaller amygdala is essentially a good thing because it means we're less likely to freak out in really stressful situations. Now, obviously, these monks were meditating for like 2+ hours a day, but this study also found that for us normal people who are maybe meditating for 5-10 minutes a day, or maybe not even at all, even if you start a very simple meditation practice of 5-10 minutes a day, you can still have a significant impact on the size of the amygdala. And so I kind of say yoga is like that perfect trifecta because it's the physical movement, it's the meditation, and also it's the breath work, which can be so beneficial on our overall health, but in particular our gut health.
And how much would you prescribe? How, if someone's listening to this thinking, okay, I love this, that's great. The thought of going to, a yoga class for an hour every evening, I'd absolutely love that, but it's just not going to happen. Um, what is a realistic approach that you would suggest?
I suggest, if possible, to try to do yoga 3 times a week, but even for 20 minutes. So 20 minutes, 3 times a week, getting on a mat on your living room floor, simply doing some stretches, but being very mindful and present and tuning into the breath. I have some videos on my YouTube channel that people can explore, or other yoga teachers on YouTube. There's hundreds of them. And then also, if possible, trying a 5-minute meditation practice every day. And so setting a timer on your phone, literally just sitting, listening to your breath. You can put music on in the background, or lots of these meditation apps now have very like ambient, beautiful sounds that you can put on in the background. So yeah, 5 minutes of meditation every day, yoga 3 times a week for at least 20 minutes.